and welcome back to the Co-Treat. My name is Jonathan, and I'll be your occupational therapy professional.
And I'm Magnolia, and I'm your speech therapy professional again today.
So, for session 2,
Yeah.
what are we talking about?
We are talking about playing with our strengths or strengths-based approach as a more professional way of saying like the name of the strategy that we're talking about.
Yeah.
Overall, we're just talking about strengths today.
Okay.
So
I love that.
So tell us a little bit about strength-based approach.
Okay, so in this preparation, we actually, to be like full disclosure,
Sure.
we actually did an in-service, basically an in-service. It was a lunch and learn type thing. Not that long ago, back in December. Was it December?
It was December.
Back in December, at our workplace on strengths-based approach. So I'm totally double dipping and using the same resources that I found then.
Yes.
To kind of help guide our conversation today.
Yeah.
So basically what we kind of found, I found the Department of Education's definition for what a strengths-based approach is. And they define it as an approach to people that views situations realistically and looks for opportunities to complement and support existing strengths and capacities, as opposed to focusing on and staying with the problem or concern.
I really like the way they word that.
I do too. So like to simplify it in like layman's terms and not so much like professional lingo, basically it just strengths-based is just capitalizing on people's strengths rather than focusing on the problem. That's really like the very simplified version of what strengths-based means.
And you found this on Department of Education's website. So that means this is an approach that teachers use and can use.
Yeah, it's kind of fun. So my mom is a teacher.
Okay.
And she's been a teacher for, I don't even know, a long time now. And I remember years ago, Mom, I don't know if I remember her actually talking about like the term strengths-based approach.
Right.
But I definitely remember conversations of us talking about using the strategy, whether or not she called it that or not. So it's a thing that's been very widespread, kind of talked about and researched and thought about in the world of education for decades at this point. But I think because of our backgrounds, we're in a more medical system. We are considered healthcare professionals.
Right.
So our, models of learning that we were taught in school maybe weren't always as strengths-based.
Right.
Maybe it was still more of this medical model, which...
what is the medical model?
Yeah, that medical model of thinking is much more... we're finding the symptoms, we're finding what's wrong, we're seeing the problem, and we're trying to fix it.
Right.
So it's very much, like if you go to the doctor's office, you go in, you have a cold or you have a cough. You're like, I've got this cough, I'm running a fever. And the doctor or the whoever is trying to figure out what's causing this fever, what's causing this cough. Let's tackle it so that the problem is fixed.
Right.
Which makes sense.
Yes.
In that kind of a medical model type.
Especially with acute issues.
Yeah. Absolutely. Like if I go into the doctor for a cough, I want my cough to be gone.
Right.
So
fix
that's
it right now.
That's what I'm going there for.
Yes.
It's like, give me the magic pill and I will never be sick again. Like that's what I want to happen. But in the world of like therapy, and also, there is a shift in kind of the medical field in general, kind of moving towards this more of a strengths-based approach. In all aspects. That makes sense.
Right.
But yeah, so strengths-based model in the medical sense, like in the healthcare profession, is really kind of directly opposed to that medical model, that traditional medical model of what's wrong with you and how can I fix that thing.
Right.
Ajax has made his first appearance. He is attacking my elbow.
And so there's nothing wrong with a medical model, especially for those acute situations where you're going to the doctor for these fixes.
Yeah.
But in the therapy world, we're not typically dealing with acute things. We're typically dealing with developmental disorders or chronic issues. And
Well,
so-
especially in our part of therapy.
Right.
It's definitely much more, I mean, it makes more sense in certain parts of,
Yeah.
even in the world of therapy. Like if you are doing acute care
Mhm.
where people are, or like post-surgery.
Yeah, like
or
orthopedic top.
Yeah. People have just had a terrible accident or you just had a
Mhm.
stroke or whatever. You are trying to like minimize the long-term, I want to say damages to,
Mhm.
you know, like what could happen. Like that is very much what is the focus of like,
Right.
we got to make sure that you don't decline further
Yes.
or, you know, because that's really important. That kind of early intervention and early treatment of those symptoms can be, I mean, vital. It can make a huge difference
Right.
to someone's long-term function and ability
Mhm.
after some of these more intense, you know, medical situations.
Right. And I see that with swallowing stuff too, as well.
Yeah.
Like, especially in acute care, like home health, things like that. You're going to work on fixing the problem right then.
Right.
What strategies can you do to fix the weaknesses?
Yeah.
And that's completely fair because this is, you know, life-saving stuff that you have to make decisions on.
Yeah.
So that is the goal for that. So, like we said, there's nothing wrong with medical model.
No.
Not whatsoever. We are just talking about strengths-based because that is what we try to use
Mm-hmm.
in the world of like pediatric therapy.
Yeah.
And there's also good benefits of it, I think, for just our normal everyday life
Yeah.
as
For
well.
sure.
So I was exposed to strengths-based approach while I was in my social work program in undergrad because that was my major before I switched.
You
And
didn't finish with a social work degree though.
no, I have a minor in social work.
That's right. Okay.
Yeah. So I didn't finish with it, but that's what I was in prior to switching to
Yeah.
speech therapy. And so I was exposed to that. I remember like a speaker came in and was like, we're going to do these activities and talk about everybody's strengths and how we use them. And I was like, oh, this is super cool. Like it was just like a way of thinking. And I started kind of just using that. And I was like, oh, I really like this. And then in my practicum at that time, I had a really good supervisor who had me use strengths-based approach with every interaction I had with clients.
Mm-hmm.
And so pretty much my interaction was going to court and watching family court, which was really hard.
Yeah.
A lot of negatives there.
Yeah.
And she would actually have me keep a strengths notebook,
That's
which,
cool.
yeah, I had to write strengths down for every individual who was in that room, which was really cool.
So not just the, okay, hold up.
I know it's
I'm
a
trying to
lot.
wrap my brain around this.
So-
That's a lot of,
Which all I was doing as a student was
that's a lot.
observing, though. So, like, I
Yeah.
had the time to observe. I wasn't having to make actions or anything like that.
yeah.
Just observe.
Yeah.
So, I would write down the strengths that I saw in the kid in the case.
Mhm.
I would write strengths that I would see maybe in the adoptive parents or the foster parents
Yeah.
or the grandparents. I would have to write strengths down for bio parents.
What about the judge?
The judge, yeah.
You did?
Yes.
Oh my gosh.
Because I mean,
It's like-
they have certain strengths.
yeah.
Yeah, like
That's
I mean,
interesting.
I remember some like instances with like, especially like adolescents. Like this one judge, one of his strengths was he would pull them aside separately
Oh, that's cool.
and listen to them, and so like
Yeah.
things like that. So there were strengths
Yeah,
for
yeah, yeah.
everybody, strengths for the lawyers, strengths for all of it.
Interesting.
So that was where I kind of got my first
what about like the security
practice.
officers?
You know, honestly, I just sat in the back with him. So
Okay.
he told me some cool stories.
That's neat.
I know, it was actually really neat.
That's really cool.
But it was a great time and a good experience because it taught me how to look for strengths.
Yeah.
Which is a skill that you have to kind of work on
It is a skill.
because it's
and-
not natural.
No, and it's honestly, very hard sometimes.
Mhm.
Sometimes it's very hard.
It is so much easier to be negative.
Yeah. Yeah. Why is that?
I don't know.
Why?
It
I
is-
don't know why.
It is so easy though. Like,
yeah.
but it can be harder to look for strengths. But once you get that skill, I think you want to use it.
Yeah.
And so that's where I kind of learned that skill. And then, of course, I figured out social work was not for me, even though I fully respect that career choice and I'm thankful for them so
Yeah.
much.
Get it, social workers. We love the
Absolutely.
social workers.
But whenever I switched to speech therapy, I was like, okay, this can still be used. Like, these are good skills that I learned
Yeah.
from social work. And so social work just kind of describes the social the strength-based approach as kind of being like a holistic approach that is person-centered is kind of the big way that they focus on it.
Yeah.
And that it's just focusing on the client's strengths over their weaknesses.
Yes.
So it's very similar to what you've read
from
the Department of Education.
Yeah.
So that's very cool.
Yeah. I love that. It's cool that it's this kind of, it really makes sense. This whole idea of like capitalizing on people's strengths makes so much sense when you're working with people because people are different and in those kinds of situations in particular, it's not helpful all the time to think about what am I trying to say? Focusing on the negative oftentimes hides what progress can look like.
Right.
It kind of puts a cloud over the possibilities for the future. And if you're, because it can be very hopeless. It can make you feel very much like, what can I do in this situation? What is possible? Because you're just, all you see is that glaring weakness or that, big giant barrier that's standing in the way of whatever it is that your goal is or whatever it is that you're striving for. So using kind of strengths-based approaches it helps to kind of bring the light to some dark situations a lot of the time.
And it's hard to do that for yourself, like if you're in that dark situation.
Yeah.
And I think with our career choice, with teachers, with social workers, with plenty of other careers that are in that helping field.
Yeah.
We are the type of people who are the ones who are supposed to show the clients or the patients or the individuals the strengths and the hope.
Right.
And all of that, because they're the ones who are in that.
Yeah.
And it is hard to see the strengths during that.
We're the third party that's like, your situation is hard.
Yeah.
But we can help.
Yeah.
Somehow we will figure this out. Whatever it is, we will help figure this out.
Right.
With you.
Yes.
Yeah.
And that's why it's so important.
Yeah.
So it is an approach, but it's also just kind of a mindset.
Ain't that the truth?
That we can just have.
Yeah.
And I'm sure there's other terms for this type approach.
Probably.
Out there that people use. But it's, like I said, just the mindset of focusing on strengths.
Yeah.
So.
Yeah, I really like that kind of thought process. I like that description of how it's really kind of this mindset because you really kind of have to train your brain to think that way.
Yeah.
And not be so hyper focused on those things that are the struggle in the moment. So let's think about, I wanted to kind of there are actual standards for using strengths-based approaches.
Okay.
And I say there are standards, but depending on where you go, like what website you look at, whether it's a social work website, whether it's an education website, whether it's a, healthcare website, like there are different standards.
Right.
There's not one uniform, like, we are the bosses of strengths-based approaches and we're going to tell you how to do it,
Yeah. It's not like a branded thing.
Right. There's no like WHO of strengths-based approach. Like it's not a thing. Unless there is. And if there is, please let us know. And we would love to have you on the pod. Like that'd be so cool.
That would be cool.
That'd be cool. But so some kind of things that I found when I was looking were, because you can use strengths-based approaches for a whole variety of reasons, like in a whole variety of settings and ways.
Right.
So I kind of found 6 that were pretty consistent.
Yeah.
Across all of the information that I was reading. And kind of the first one is this idea of like goal orientation, like what are the goals?
Okay.
Like developing the goals with the family, and specifically for us in our pediatric practice, it's like the family and the child identify what's most important. They identify the goals, and then with the support from us, the therapists or the therapy professionals, we help to support them in meeting their personal goals.
Right.
Rather than, because this is what we got to be careful of, and we actually were having a conversation about this just yesterday or
Yeah.
when the other
Someday
this week. We were just talking about how like it can be very easy as a therapy professional to decide what's important for our clients.
Right.
And have like they walk in the door and we're like, these are all the things that are wrong with your kid, and this is what you should be worried about. And that can be very easy to fall into that kind of trap, but that's not a strengths-based approach.
No, it's definitely not.
No, it's very much like you let me know what's important to you. You let me know what your personal goals are, and I'll help you. We'll try to help support you in that.
Yeah.
Which honestly, going through my like OT program right now, it's really kind of amazing because in our curriculum is strengths based.
Yeah.
Which is really exciting to me because our whole we are constantly talking about what's important to the client. What are their personal goals? What are the things that they are struggling with, or the occupations that they're having a hard time engaging in, and how can we help support them in that?
Yeah.
That's really kind of our whole curriculum.
Yes.
Is using this kind of strengths-based mindset, which is really cool. And it makes me feel like a superhero sometimes. I'm not going to lie.
I love the curriculum. So that's awesome.
Curriculum. You don't love me being a superhero?
I mean, that's okay.
I feel like I could be a superhero.
And we're gonna talk about
sidetrack.
Not what?
If you could be any superhero, who would you be?
I don't have an answer.
Oh my gosh. Lame. Wait, do I have an answer? I don't even have an answer.
We'll think about it and come back on that one.
No, wait, I do know.
Okay.
I would be Jean Grey from the X-Men because she's got the coolest powers. Telekinesis and telepathy. Hello. That's super cool.
Yeah. I just don't have one right now.
Okay, lame.
I'll think about it.
You have until the end of this pod.
Okay.
You better
anyway.
Crack-a-lackin'.
So we're going to talk more about this in a little while, but I'm just going to go ahead and add in that all of these standards that you're talking about, we're talking about them with the words patients or clients, but you can substitute that with students or your own child.
Yeah, for
your
sure.
Your coworker, whatever. You can replace that word clients or patients that we are going to primarily use in the rest of this conversation to add it to your own situation.
Yeah.
So anyway.
Make it personal.
Yeah.
Take these concepts and run with it.
Yeah. So give us number 2.
Okay, number 2 is like an intentional strengths assessment.
Okay.
So it's kind of this notion of identifying the strengths in the child and the family. What kind of resources do they have? What kind of supports are they working in? So you're actively searching for the strengths.
Yeah.
It's very intentional. You're not just like, boop, 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 boop. Oh no, look, that was so crazy. That's a strength. It's like you are actively searching out for what are these things that are supportive? And what are these strengths that these not only, like in our case, not only are the kids' strengths, but also the parents' strengths and also the the environment that they're working in. It's really crazy. Honestly, I'm reading these things and I'm like, baby doll, is this just OT? Because I think that it is. Because
so we can all do OT, guys.
You can all do it. Well,
I'm just kidding. We need a degree.
there are some requirements.
But we can all use ideas from OT.
Absolutely.
In our own lives.
No, absolutely. Because literally in the world of OT, okay, so I'm just going to nerd out about OT for a second. Hope that's okay on this therapy theme podcast. But a lot of the concept that we've been learning about recently in my OT. Okay, so I don't know if I fully explained all this. I'm currently in an occupational therapy bridge program.
Right.
Which means that I am an occupational therapy assistant, but I'm going back to school it's a graduate program where I'll get my master's in occupational therapy to go from an occupational therapy assistant to an occupational therapist.
Yeah. So he's a full-time employee and is in master's program.
It's a master's program.
That is crazy.
Yeah.
Look at you.
Full-time school and full-time work.
Love it.
I have 17 credit hours. Or is it 19? 17?
You have 19, I thought.
I have 9 classes and 17 credit hours. It's a lot. But we're living the dream. Living the dream. It's exciting. But in this program, we're talking about the occupational therapy process, and literally this is the first step of the process. These are the first steps of the process. It's like, what are the things that are important to you guys, and then what are the things that you've got in your person, in your environment, the support systems that you have that we can capitalize on. This is literally just an OT evaluation.
Love it.
This is great.
So give us step 3.
Step 3.
Standard 3.
Standard 3. I don't know. It's resources from the environment. So like identifying that within every setting, there are people who have something to contribute.
Okay.
So no matter what setting you're in, I think I typed something in wrong. It's totally fine. But basically it's the idea that within the setting, like people can be productive and have something to contribute within whatever setting they find themselves in.
Okay.
So you are, and then there are also resources within your environment that can help.
Yeah.
You know?
That makes sense.
So you can be a resource to your environment, but then you can also use the resources in your environment to support you.
Mm-hmm.
Does that make sense?
Yeah, that makes sense.
So really kind of finding that intersectionality of this is what I got going on, this is where I'm at, and like how to merge the two.
Yeah.
You know?
Mm-hmm.
Any other comments?
Not yet on that one.
Okay.
I'm just thinking of like the environmental stuff. I'm trying to think of a good example for it. And I think, for example, I know like one of my strengths is that I do better in quiet environments.
Mm-hmm.
And so even like prior to this, we had like a little air purifier thing going on in this room. And I was like, hey, can we turn that off? Asking for the environment to be modified.
Yeah.
Because my strength is working better in a quiet environment.
Yeah.
So I needed the environment to change.
For sure.
To suit my strengths.
Yeah.
And so that's kind of the way of, a very simple way
yeah.
of giving an example to that.
I love that. One of the big, I don't know, I'm trying to look. I know that one of the concepts that, like when I had done all these things, one of the big concepts of using like strengths-based approaches is, are you adapting the environment before you're trying to change the person?
Right.
Like before you try to change an individual and make them different or make them try to be different.
Right.
Are you providing them an environment that makes sense for them?
Yeah. And like, so with that example I just said, it would be much harder to try to change who I am as an individual of, you just need to be okay to work in any environment.
Yeah. Be fixed.
You know, like and
yeah.
I don't see that as a weakness. I find it as a strength that I can just focus better.
Yeah.
In a quiet environment. Like I'm very productive.
For sure.
So it's much easier to modify the environment in that situation.
Yeah.
So.
And some people, I think it's important in that situation. A lot of people will be like, well, that's normal. Like people do that all the time. It's normal for people to work better in a quieter situation.
Yeah.
But that's also like, that is true. There are many, many people who work, I am also one of those people who work better in a quieter, calm environment. Mm-hmm. But that doesn't mean it's any less a strength. Just because many people have the same strength doesn't make it any less a strength.
Right.
But then also, some people don't.
Mm-hmm.
Some people have a really hard time working alone in a quiet space. Mm-hmm. They really need noise. They need something going on to kind of help focus their thoughts. I don't totally get it because that's not my experience.
Same.
I need like background noise of like, it's funny, actually, our noise preferences for when we're focusing are so different.
They're different, but they're the same. They can't have words.
No, you cannot be, there can't be any, I can't listen to my Disney podcasts or my Disney like music.
And I can't listen to my Broadway musicals because, I'll start singing. Can't handle that.
It's a no-go. I need calming music, but also calming unfamiliar music.
Yes.
So I can't have, like I was telling Magnolia the other day, I was like, I can't listen to like classical music Pandora. Do people even still listen to Pandora? Does that exist anymore?
I know a few people do, but no hate to Pandora.
I don't know. Get it together, Pandora. Get with the times. But it can't be like classical music because it just recycles the same 7 or 8 songs. Yes. Beethoven's whatever in C minor or something. I don't know. Like it just recycles the same songs over and over again. And I'm like, baby, no, I've heard this one, but this one was a piano. That one was a harp. This one's a violin. Like so then I get too focused on, I've heard this song before, but last time it was an oboe and this time it's a whatever. So I need really obscure classical music. Well,
Yeah.
obscure to me because I'm not a classical
But
music.
see, like my music's similar in that way because I listen to the lo-fi beats type stuff, which is never the same,
Yeah.
but it's more upbeat.
Mm-hmm.
But I like that it keeps me, I don't know, it keeps my brain engaged,
Yeah.
which is it's different. So we all have
Yeah.
those strengths of like what we need.
Yeah.
And it's easier to change the environment. It would be easier to change the playlist for
Absolutely.
you, change the playlist for me,
Mhm.
versus like changing one of us.
Right.
And so that's kind of a very simplified way of explaining that
Absolutely.
process. But we all do it, just kind of the point.
Yeah.
We do this type of stuff all the time
All the time.
to fit our strengths.
Yes.
And notice we're not saying our weaknesses. We're using this as we're fixing it for our strengths.
We're adjusting it,
Yeah.
making changes.
Much better word. Yeah.
Modifying.
Modifying it. Yeah.
Modifying.
Love that word.
Yeah.
Modifying it for our strengths.
Yes.
I do not see it as a weakness
No.
that I need a quiet environment.
No.
Not at all.
Mm-mm.
Especially since I can easily fix or modify it. I keep saying fix. Ugh.
Girl, you gotta get out of
Modify
that.
it. I gotta fix my language. Modify it. To suit
gotta
my
modify your
needs.
language.
I gotta modify my language. I'll get there. Okay, moving on. Where's 4?
Moving on. Number 4 is adaptive and alternative methods.
Okay.
So exploring adaptation or alternatives that capitalize on identified strengths. So this is like adaptive strategies. So rather than changing the environment,
Mm-hmm.
like adapting how we're doing things or modifying like our tools and stuff.
Yes.
So
My speech brain goes straight to AAC,
absolutely.
which is just alternative forms of communication. And so, like, we
Yes.
have, the iPads, the devices, the pictures,
Yeah.
those things.
Oh my
Because
gosh,
we're
I
not
have
changing.
a great example for this, but you go ahead. Sorry.
No, it's okay. We're not modifying their environment.
Yeah.
We are just adapting their tools, adapting their
Yes.
way of communicating. And so, like, my
Yes.
brain, sparks that one. I'm like, yes, we can do this. We can allow you to adapt the way you communicate.
Yeah.
Like, that is a strength
I love
for
that.
you. And so, tell me your story.
So the example that comes to my brain, and honestly, this was like, there are moments in your career that you really just popped off and you're like, I did that. And you
Yeah.
feel so proud of yourself and
That
you're
is
just
true.
like, boom, I just crushed this moment. Go me. And this is one of those moments for me.
Okay.
There are plenty of times that I'm like, wow, Jonathan, that was a real booger moment and you messed up. But sometimes you do something and
Did you
you're
say booger moment?
a bit, yeah.
Okay.
Is that a problem?
It's fine. I just like how you bring up snot and boogers every.
Listen, there will be a reference to boogers
Anyway.
every episode of this podcast
Sorry.
if I have anything to say
So
about
tell me about your win.
it. But this was a major win for me. Well, both for me and for my my kiddo. I've been working with this little friend. He wasn't a little friend. He was an older guy. He was like 13.
Mm-hmm.
I don't think that's true. I think he was like 11.
Okay.
I can't. Ages are hard. I don't remember.
He was no longer little.
He was like preteen
Okay.
age, probably.
Okay.
I think. And this little guy, very smart. Like he very much understood a lot of what was going on, but he really struggled to follow verbal directions.
Right.
And he really struggled to make choices, to
Mhm.
make volitional choices. So a lot of times what would happen, just as an example, he would, if I asked him, like maybe we're going to color a picture or we're going to play a game or whatever. And I asked him, what color do you want? He would point to each color and he'd go, this one. And while he's pointing, he would look at me.
Mhm.
It's almost like he was waiting for me to tell him what the right answer is. And I'm like, there is no right answer. This is fully just whatever you want. Like,
Mhm.
I don't care what color you use.
Right.
You pick it. Like, this is your thing, baby doll. Like,
Mhm.
it does not bother me what color you pick. But he would
Right.
go, this one, this one, this one, this one. And he would just watch me until I made some sort of, I nodded or I said something or I
Mhm.
made some sort of like action of confirmation.
Right.
And that would be kind of how he approached every situation.
Mhm.
And what we learned one day, it was actually with the help of a speech therapist. I knew that he was a really good reader
Mhm.
because he could read any book that I gave to him.
Right.
And it was with the help of a speech therapist that we really kind of cracked the code on he struggles with the verbal instructions, but maybe we can capitalize on his reading ability because he's a really great reader.
Mm-hmm.
So what we started doing since then is I write down my instructions for him. And so if I had asked him, what color do you want? He would go, this one, this one, this one, while he's looking for some sort of confirmation. But when I wrote it down and was like, just pick a color, just wrote down step 1, pick a color.
Yeah.
He would pick a color and then he'd do it.
Wow.
He would read it and he'd read it out loud, pick a color, and then he'd get the color that he wanted.
Yeah.
And I was so stinking excited. It was,
that is a huge win, though.
It's a huge win. It really changed how we all interacted with him.
Right.
And how we presented instructions for him, because suddenly with this introduction of written instructions, I mean, his executive function skills to be able to like execute tasks, to plan the task, to execute the task, it exploded. But it's not like he was learning these things from the beginning. Like, he had that ability in him. He just wasn't able to capitalize on it because the environment, or the not the environment, the activity was not suited to use his strengths.
Yeah.
So when we found that, I mean, it changed the whole game.
Yeah. I mean, and you did adapt the communicative way of talking to him.
Yeah. It was
to provide
so cool.
the directions.
Yeah.
Super cool.
I was so excited about it.
It's a perfect example.
It was
for that.
Yeah. I mean, that day I really felt like I did something pretty special. I was like, yeah, we did it.
Love it.
Those are the days that we live for.
Yes.
You know, those are the moments that we're like, we're shooting for that all the time. We want that every day.
So true.
It was very exciting. And then, okay, so number 5.
Number 5.
Fifth standard is the relationship being hope-inducing.
Which we kind of addressed earlier.
Yes.
That we are in the helping profession.
Yes.
Our goal is to help.
Our goal is to help.
Which means we need to give hope.
Right.
To the patient, to the family.
Yeah.
So that's very important.
Absolutely. Because like we said, you know, if you focus on all those negatives, it can feel really hopelessly debilitating.
Yeah.
Because, you know, well, for instance, this happens, I mean, it happens all the time, and you can speak to this. How many of our families come in and they're like, well, she's 3 years old and she just doesn't talk.
Yeah.
And that's like, is she ever going to be able to talk?
Right.
And it's like, maybe not.
Yeah.
She may not.
In all honesty, true.
That doesn't mean that she can't communicate.
Right.
And that doesn't mean that she can't be successful and very productive and very fulfilled and very satisfied.
Yeah.
It's like, she may never talk.
And it's kind of the move, and a lot of the speech people kind of notice this as well, that's kind of been talked about, is that we're moving away from just diagnosing children with being nonverbal. Like, that's not really the wordage we use for that anymore, because it takes away the hope.
Yeah.
You know? Like, if that, in that instance, if a parent of a 3-year-old comes in and they're like, they're not really talking, I'm really concerned. There has been a trend in the past to be like, okay, your child is nonverbal. Meaning, we don't know if they will ever verbally communicate.
Right.
Or speak. And so, I think that's very, like, not hope-inducing.
Yeah.
Not strength-based.
Soul-shattering.
Yeah. And so, I make it more of a point to be like, well, they're not talking right now. This might be what's happening. Do we need to address any of those concerns? And then, here's kind of my plan to try to help engage their communicative systems no matter what the modality is.
Yeah.
So using different types of forms to help encourage communication. Because our main goal is not verbal communication. Like, that is not the only goal.
Right.
That is not the only strength. Yeah. And I think parents just need to...
You mean your only goal in speech isn't to speak?
I know, right? It's communication.
Yeah.
I wish we were like communication, but it gets confused.
Yeah.
Which we actually are. I mean, all of our majors are in, like, communication sciences and disorders, things like that. We're not actually, like, in a degree of speech therapy. Yeah. So our focus has to be on the communication aspect of it. And so like that is the main goal. And so if I can find the strengths in that and how their strengths are in their form of communicating, well, then let's maximize on that. But that does take a lot of parent education because I want to be able to give them hope, but I have to explain to them that there's hope in communication.
Yeah.
We just have to find those strengths.
Right.
But I think that's hopeful. I think I see a change in the parents' faces about like, okay, cool. My kid, it's just, their brain is different.
Right.
So they want to communicate like this. Like I want to communicate with them, so I'm going to learn how to do that too.
Yeah.
And that's great.
Yeah.
Brings so much joy.
I think that is really exciting.
Yeah.
And because I think that happens a lot. You know, we were talking about earlier, you know, like the medical model and people really just wanting things to be fixed. And so many times that's what happens when families come to us.
Right.
Is they really come to us with like very major concerns. And they're like, I just want my kid to be better.
Right.
And they just, you know, I mean, if they could, a lot of the times there's so many families that if they could just like wave a magic wand and their kid, you know, become typically developing, they would so do that.
Yeah.
And I get it. You know, like
definitely.
I get it. Because when because your life, I mean, let's be real. I don't have children, but I know bunches of people who have kids. And I cannot imagine truly being like the sole person that's responsible for a kid all the time.
Mm-hmm.
It blows my mind that people do that because like the task seems so monumental to me. Mm-hmm. So it is not lost on me. Just the struggle of being a parent in general, because it's hard work to like, I mean, this tiny little human depends on you for everything.
Yeah.
And then when there are things that happen that you're not prepared for, like their development is, you know, interrupted, or they have some extra, you know, associated difficulties, whether it's orthopedic things or neurological things or whatever it is, there's these other barriers. Like it just compounds upon the already hard task that is being a parent. And so a lot of times parents really just want it to be fixed. Mm-hmm. But what our role is in a lot of those instances is communicating to the family. It's like, well, realistically, because this is also part of the thing. I don't know if this is the same thing in the speech world, but in the OT world, we actually talk about like part of our role is to educate families on their diagnoses and like give you some realistic understanding of what your functional implications are. Yeah. Like, okay, your kid has autism. Like your kid is on the spectrum. What does that mean? Yeah. What could that mean? Absolutely. Every kid is different. And so everybody's strengths are different. Mm-hmm. The way that they present is going to be different. But based on what we're seeing with your kid, this is what we're hopeful that we can, like, what the future can look like. Right. And so is it going to look the same as my life or, you know, the parent's life or whatever? Probably not. Yeah. But that doesn't mean that it's bad or that it's like any less valuable. Yeah. You know?
And if you can't end an evaluation with some sort of hope at the end of it, what is the point of like even planning the intervention anyway?
Wow.
Does that make sense?
Yeah.
Because like,
I've never heard somebody say that, but
I don't know. It just kind of came.
That really just kind of hit me.
But there's like a whole therapy plan. So like, why even plan all of it without being like for the bigger goal? Yeah. So we have to express that hope to the parents. And I think that'll help increase our buy-in and...
That really just kind of like, I don't know. I just really love that.
Okay.
That just like kind of rocked my world a little bit.
Okay, well, you're still sitting there.
Like,
I do love what you said about, you know, going in and addressing, like talking about different diagnoses, things like that. And I've read a lot about how that like humanizes different difficulties. Yeah. Instead of, you know, making it so either stereotypical or so scary. So I don't know. All of this, a scary situation when it's not too scary. Yeah. Whenever we can be there to help you and to identify the strengths. Yeah. Of like this individual is still this individual. Yeah. They just have different abilities. Right. And they have different strengths. Yeah. We can maximize on that. And I think it definitely humanizes that of like each person is different.
For sure.
Each autistic individual is different. Yeah. Each child with Down syndrome is different. Yeah. and everything else
Right.
in between. And so I think that humanizes it.
I agree.
If we explain it to them, to the parents of like, your kiddo's brain is just different.
Yeah.
And that's okay.
Yeah.
And we're going to find a way
Mm-hmm.
to help them reach their big goals.
Right.
Whether it's using one of these strategies we've talked about of adapting the environment, giving them different alternative forms of communication or sensory strategies, things like that.
Yeah.
But it's that humanizing it to give parents hope, I think, is another little thing.
I really like that. I think that a lot of times, in my experience, so many times when I've had conversations with parents about, so this is what the diagnosis means. Like, this is what it often looks like. And this is what you can expect, maybe. Because it's also hard. Like, you really have to consider the individual child. You can't use blanket statements a lot of the time. Like, specifically, if I'm talking about autism, a lot of the time the approach that I'll use is, I'll explain, this is the diagnostic criteria for autism.
Right.
So these are the two broad categories, your, profound language and communication delay, and then your, repetitive and restrictive behaviors and interests. Like, that's kind of the big major categories. This is what they often look like.
Yeah.
This is what I see in your child specifically that kind of fits into those categories. Or sometimes the things I see in your child that don't fit into those categories. And we talk about it kind of broadly and then go more specific. Because we also don't want to tell somebody, well, your kid has Down syndrome, so this is what their life is going to look like.
Right.
Because I don't know that.
Yeah.
Because like we said, everybody's different and all their strengths are different.
Absolutely.
I know many, many kids with Down syndrome, and I'm just going to tell you right now, they are all different.
Very.
Just like every other person that I know. No two people are the same. So yes. And I think that strengths-based approach kind of weaves its way in there because you are talking individually.
Yeah.
It's like, these are common things to see, and this is kind of some real life ways that it can manifest.
But that's the time to start using that part of your brain that's using the strength-based approach. Exactly. It's like, okay, here are the strengths I see in your kid. Yeah. Now that we've talked about this.
Right. Well, even in just like the kids from a communication standpoint, right? Yeah. Like, we have worked with kiddos, worked with some, just using Down syndrome as our kind of diagnosis, just as an example. We've worked with several kiddos with Down syndrome who are very verbally communicative, can hold conversations with you. Right. Like, they have very fluent verbal communication.
Yeah.
And then we've worked with others that use devices. So even just within that that singular diagnosis, which has a lot of very stereotypic kind of, it's very recognizable to a lot of people. But even within that, like, all these kids have different strengths.
They do.
And so I can't tell you what it's going to look like without using this kind of strengths-based approach to be really more specific.
Right.
So
I love that.
I think that's really cool. And then we're down to our sixth one.
Yay!
Our sixth of six principles. So our last one is that meaning. It's kind of classified as meaningful choice. Okay. So really highlighting the fact that the family and the child, in our case, are experts on their own situation. And we value this knowledge during our intervention, during our plans, whatever. Right. Like, they are the ones who know their situation the best.
Right.
So we cannot come in here and tell them what their life is like or what their life should be like or what, the struggles that they are facing or the barriers that they are, whatever it is. Like, it is not our place to come in here and tell the family what they're going through.
And like, no person likes someone coming up and telling them, hey, this is how you feel.
Yeah.
Or this is what you need to do.
Yeah.
I mean, I remember being a kid and like, if my mom told me this is what you need to do, sometimes I wanted to do the exact opposite.
Yeah. Yeah.
So we have to take that into account. These are just normal people. Yeah. We don't like these feelings.
No.
We want to be asked, hey, what do you want? Hey, how do you feel about this?
Yeah.
And that's what we need to respect to our parents and the patients.
But these are also things, okay, so these are things too that transcend just pediatrics, right?
Right.
Is Ajax attacking you?
It's okay. It's sweet.
I don't know. Those are some big, scary teeth. Rawr, Geeter Ajax. But these are things that, even go outside of just kids,
Right.
even with older adults,
Mhm.
or just adults in general.
Yeah.
These are also concepts that are really important because they are the experts of their own life. And if, how many times do you give recommendations and you're like, or give suggestions and you hear feedback of, I don't know, that doesn't work for us. Like
Right.
that doesn't make sense for us. Like
Yeah.
I can't do that. Or
Mhm.
like that's not going to fit in our routine or fit in our lifestyle.
Yeah.
And if you just stick to it where it's like, well, this is the only option that's going to work for you. So if you can't do it, then you're just non-compliant. That is
Mm-hmm.
you are immediately putting up a wall between
Immediately.
yourself, that client, and their potential for progress.
Yeah, in full honesty, and this may just be a personal perspective, but like I hate the word non-compliance
I can't stand it.
because it's not their job to be compliant to anything,
No.
especially a kid, first of all.
Especially a kid.
Um and also adult who has their own autonomy. Like honestly, they don't have
Yeah.
to either.
Because you saying that I'm non-compliant implies that you are my boss.
Right.
And that you somehow should be able to like lord over me what I should do.
Yeah, there's never been like a signed agreement of like,
No.
yes, I want to do this. There's
No.
not a contract. Like,
Right?
we have prescribed this care for them.
Mm-hmm.
And then if they don't want it, they don't want it. But
And
we
that
can
is
try
their
to find their
choice.
strengths to help motivate them if we can.
Yes.
Especially like with older adult patients who might need, some more education on the topic, whether it be like after a stroke patient, maybe they need some more help. Specifically, also, I'm thinking of like adults who've had TBIs.
Sure.
So their personality changes, their cognitive levels changes. They may need more supportive help to show the need for them.
Right.
But still, it's not non-compliance.
Exactly. It's like, absolutely. And even in those moments, like you said, it's not non-compliance because for some of those people who've had some personality or mood changes due to whatever, whether it's dementia, TBIs, maybe it's severe mental illness, like mental health struggles that they're dealing with. A lot of the time, if they're having a hard time engaging in like complying, air quotes, complying with the plan that you've made, maybe that's just a symptom of their greater struggle.
Right.
And if they were not symptomatic in that way of like their whole personality or mood being different, maybe they wouldn't. So, they're not just trying to be difficult just to be difficult or whatever. Maybe that's an opportunity that either we need more education and you really got to like drive home, this is why we're doing this. This is why I feel like this is a good thing to do.
Yeah.
And if that still doesn't work, then maybe you need to work with them in ways. There are still methods that you can use to approach the situation in a way that they are gaining therapeutic intervention, like they are receiving therapeutic intervention,
right,
without it feeling so much like a doctor's prescription. And it's like, we're going to do these things 5 times a day and blah, 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 blah.
Yeah.
It's like we can still make it meaningful.
And we definitely need someone who still works with adults to kind of come in and give us some feedback on that as well. Because I'm also thinking about like end of life stuff.
Yeah.
Like those decisions are for the patient.
Yeah.
And their family.
Absolutely.
And so like in the speech world, I'm thinking about like, the decision of like, should an individual get a PEG tube or a feeding tube versus just eating what they want towards end of life.
Yeah.
And, that's a big discussion often, but primarily we need to remember that it comes down to what the patient wants.
Yeah.
And what their decision is.
Right.
And not what we think is best for them.
Yeah.
And I think that's kind of like where it all ends at right there is they get their last choice.
Right.
And that's so important.
Yeah.
So even from like our little kids making their own decisions and telling us what they want to do to end of life choices, we need to respect that.
Yeah.
All the way through.
I agree. Bringing it back to our little kids.
Yes.
All the time, we hear, like there's some adult that comes in with a toy that they choose to play with a kid.
Yeah.
And the kid's like, I don't want to do that. Like, no thanks. That does not seem, I don't want to. And they avoid engaging with that toy.
Right.
is it strengths based and client centered to then expect that the child should magically become excited and want to play with this toy
Absolutely not.
just because you said so?
No, that is so like forced adult focused.
Yeah.
I mean,
I'm like, you are walking into the situation telling the child what they should be excited to play with.
yeah.
And I'm like, okay, if you really want to play this toy, then honey, that's on you to make it exciting
Yeah.
and make it fun.
Yes.
If you are so like determined to play with this, I don't know, what's a toy that people play with? Play with this puzzle.
Yeah.
This little like form
puzzles
puzzle.
are not exciting.
For some kids, it's their favorite thing in the world.
True.
For other kids, they will take every single piece and throw it at your forehead because they can't stand it.
Well, because they see like, oh, this is a prescribed step-by-step procedure you're wanting me to do.
Yeah, absolutely.
So I'm just gonna not.
Like, no thanks. This is not fun for me. And so, using that kind of client-centered and strengths-based approach of this kid absolutely engages in things.
Mm-hmm.
They're really great players with things that they like.
Yeah.
And things that they're motivated to play with.
Mm-hmm.
And things that, or maybe they just need somebody to like show them that it's fun.
Yeah.
Maybe that's all they need.
And so like if you're wanting in that case to complete a puzzle, say that's your whole entire goal for them.
Yeah.
Like you said, walking in with a puzzle and just laying it down, it's not going to be enough.
Yeah.
That's not strengths based.
Yeah.
Because as if the kid doesn't love puzzles, if that's not their motivating factor. So you've got to find their strengths, what they do like you said, play. Like I know, for instance, we've had kiddos who love the slide, love to watch things roll down the slide.
Yeah.
So I love having them put their puzzle pieces at the top of the slide, sliding the puzzle pieces down one at a time, as many as they want, whatever, sliding them down, making it fun and engaging so they're not upset with the puzzle pieces.
Yeah.
And then then they slide down and I see that they're more willing to complete the puzzle when we're done with it.
Because it's now become it's become a piece of a larger, more exciting.
A piece of a puzzle.
It's become a piece of a puzzle. Oh my gosh. Yes. It's become this piece of this larger, like, fun experience.
Yeah.
Or, I mean, how many times do we take puzzle pieces and stick them in sensory bins?
Yes,
and it's
absolutely.
like, or you get a puzzle of things that they like.
Yeah.
It's like I've had many experiences where I'm bringing a puzzle because I love puzzles. Let's be real. We are not poo-pooing on the puzzles. No. I love a puzzle.
But there's just a lot of kids who do not.
Exactly. And so some of our kids love animals.
Mm-hmm.
I've got a safari animal. Like I've got a jungle animal puzzle. And we've got farm animal puzzles. Some kids really like transportation items where it's like trains and planes and automobiles. Is that a movie?
Yeah, something.
Never seen it, but maybe they like those kinds of things.
Yeah.
Cars and things that go vroom.
Yeah.
So maybe you pick one that makes more sense for them.
Right.
Or so many of our kids, it's really wild. We've had some kids who could not care less about just an animal puzzle or whatever.
Mm-hmm.
But you get that little numbers puzzle.
Yes.
Oh man. They're like, I can do a puzzle all day long. I've got the skill to be able to do a puzzle all day long. You just didn't give me one that I was motivated to do.
Right.
And I was like, okay.
Yeah.
Yeah. That
and like
totally fair.
Some other, quick little fun ideas, putting some stickers on the puzzle pieces for them to pull off.
Cute.
To like reveal what's under it.
Yeah.
And then putting like putty on the puzzle pieces. Because like kids love to pick things off.
They do.
I don't know what it is.
They do. I don't know either.
It's just engaging.
Well, to be fair, I enjoyed picking like maybe no.
Well, I mean,
I'm not gonna go where I was gonna go with
it. It's a common thing. Like people pick on things. Like I think they even sell things that you can like pick.
Do you know what I saw yesterday? Okay. This is what like more my brain goes. I saw this because where I went when you're saying picking things, I'm one of those people that like Dr. Pimple Popper.
Yeah.
I love watching Dr. Pimple Popper. There's something that's so satisfying about that. And I saw this toy the other day that was this person that was literally popping these gigantic pimples.
And kids love this type of thing.
I get it.
You love this type of thing.
I love it. I mean, like, I have a like a grimace on my face the whole time, and I'm like looking very terrified at the whole situation the entire time, but I can't look away. I'm just like, I'm zoned in.
Oh my god.
I love it.
So, for Jonathan, that's his strength there. So
It totally could be.
that would be like an activity I need to pull out
Yeah.
for you. Now bring it out to me and I'm going to be like, I'm not touching that.
Yeah.
I refuse.
Which is totally fair.
So
I mean, totally fair.
it's all about our strengths.
It is.
So-
Everybody's like, it's all just a little different.
So we've talked about those 6 standards or just types of care. So I think we're just going to quickly talk about some of the ways that we can use it, even though we've kind of already addressed it. I feel like we've definitely already talked about how to use strengths in intervention.
Yeah.
I think we've covered that
Yeah.
throughout this. Using strengths in evaluation, I think we've definitely covered that about how, focusing it in with the parent's choice, looking for the strengths of the kid. I think that was all part of
absolutely.
of those. One thing we didn't really talk about yet is like using strengths with the parents as far as like maybe identifying some strengths of the parents.
Mm-hmm.
I think that's another important aspect.
Yeah.
And identifying those strengths and telling the parents that.
Yeah.
Because as a parent, like as a mom myself, it feels really good when somebody says, "You're doing a good job."
Yeah.
My favorite Bluey episode, there's a mom that sits down with Chili and she's like, "You're doing a good job." It's called the Baby Race episode. And it just like
not sponsored by Bluey, but
Not sponsored by Bluey.
we'd totally be down for that.
but like it literally melts my heart. I'm like,
Yeah.
that's what people need to hear. These parents need to hear, you're doing a good job.
Yeah.
The fact that you're in this evaluation room, you're doing a great job.
Yeah. I agree. One thing that kind of happens a lot, and I think it's just kind of, it's very easy to fall into that kind of mindset. And sometimes we just have to remind ourselves, it can be very easy to be kind of negative when it
Right.
comes to sometimes even full disclosure,
Mhm.
sometimes even with parents where you're just like, they just don't seem to get it. They're just having I keep telling them all these things and they're
Right.
just having a hard time. Like, I don't see a whole lot of carryover and,
Mhm.
all these things, and it can feel very disheartening as the
Yeah.
clinician
It
at
can.
times. But it's also, I always try to remind myself and then other people, I'm like, but they're here.
Mhm.
Like, they're coming. They are bringing their kiddo to me
Yeah.
because they love their kid. They are seeking support. They are seeking help. They're coming. They are taking time out of every single week,
Mhm.
sometimes twice a week,
Yeah.
because they care so deeply about their kid that
Mhm.
they're wanting help. They're
Yeah.
needing support. And that is a huge win.
Yeah.
I tell parents all the time, that is, I've had many instances where parents have just really been struggling. And this is one thing too. Okay. So it really just kind of this is another example of that,
Mhm.
where I've worked with one family where the mom, she was known by the clinicians to be very kind of stoic and seemed
Mhm.
very reserved and kind of almost cold,
Yeah.
And one day I made a specific effort to pull her aside. And we talked for 30 minutes, me
Mhm.
and this mom. And in that 30-minute discussion, suddenly everything made so much more sense to me,
Mhm.
because I was like, this is not a mom who is unconcerned,
Right.
who is disconnected from what's happening with her son.
Yeah.
This is a mom who herself has her own mental health needs.
Yeah.
She becomes easily overwhelmed, and she has a harder time because of her own history connecting with people.
Mhm.
So her willingness to bring her son is a huge plus. She not only brings him to us, but she also takes him weekly or once every other week to a counseling place.
Yeah.
She's been his advocate at school to do all these things. And so it really just required somebody to dig a little deeper,
Yeah.
and someone to really kind of take the time to find out more,
Mhm.
to realize, no, this is a mom who cares so deeply about her son that she's willing to like move mountains, like
Yeah.
make any accommodations to her life, disrupt her whole work situation to take him wherever he's got to go to help support him. And it never, like, we never would have got there if somebody had not taken that extra time to be like, let's explore,
Yeah.
you know, and just kind of stuck at that kind of more, that harder exterior,
Yeah.
you know?
Definitely so.
So yeah, parents they just need support.
Well, I mean, the parents are in our world where we work with pediatrics. The parents are a client too.
Absolutely. Oh God,
Like,
I wish we had more time to talk about that.
yeah, that's probably a whole other thing. So anyway, parents, you're great. Keep doing
we appreciate
great thing.
you. The wonderful things that you do. We had so much more to talk about.
Yeah, we did.
That we just didn't get to. So we will pass that on to a next episode.
Yeah,
eventually.
this may need a part 2.
Maybe.
I'm
We'll
just kidding.
see. We'll see what happens. I don't know.
We'll see.
So like, okay, before we go,
Yeah.
I do want to introduce a tradition
Okay.
where we start talking about like a therapy win.
Right.
So, do you have a therapy win from this past week?
I do, actually. And I'm going to use it so that you don't use it because I don't know if you might want to use it.
Oh gosh.
But
Okay.
we have a friend. I love her so much. She has Down syndrome. So, and she is just the sassiest little thing in the entire world. But I love her so much. And her strength is pretend play. Like, we can say that over and over again. If you can do pretend play, she is there. Yeah. And so we recently got a like play doctor's kit because she loves pretending to give shots and to pretending to be a doctor. And so we totally just embraced that this last week. And it was so much fun to see her go through each step of pretending to be a doctor, to the point that she was checking my blood pressure, checking my temperature, looking in my ears. Like, I was very impressed with her. And it was just amazing to see her social skills, her communication skills during that time. She even like went out of the room, knocked on the door, came in, introduced herself, and asked how I was. And this is the same child who sometimes will elope and get under tables and be very difficult to engage with when it is not using her strengths.
Yeah.
Does that make sense?
Yes.
And so it was just it was great experience for me. She had fun. We got to take turns with it. Great social scenes. And I don't know, it just made me so happy. It was a great win.
Yeah, that is a great win. I will use the same kiddo.
Okay, fine.
Different scenario.
Okay.
Because same day.
Yeah.
That is also one thing that is trickier for her to engage with a lot of the time is like handwriting activities, and really trying to practice some of those like handwriting skills. It can be very challenging to engage her in it, because let's be real, handwriting sometimes is boring.
Yeah.
It is not always super fun. But that day in particular, because she was so engaged, she was like excited to practice writing her name. And so like we got her first name, we got her family name.
Wow.
Like, I mean, she was super engaged. I'm still it anyway, but
well, we both got to see her that day. It was a great day.
Yeah.
So that can be our team therapy win.
Big win. Big co-treat win. Well, it wasn't a co-treat.
It wasn't even a co-treat, but still, multidisciplinary approach win. We worked together, and even though we weren't in the same session,
we did it.
We had a good session.
Yes, it was wonderful. Like that was a really good day.
Yeah.
So as we're signing off,
yes,
we have officially launched an Instagram.
Whoop
whoop whoop. It is the.co-treat.
Yes.
So please look us up. Hang out with us on there.
We will be making a post for strengths-based approach. We would love it if people would comment some strengths that they maybe notice in themselves
Yeah.
or strengths of others and tag a friend. Like,
What are the strengths that you see in your own kids?
yeah,
That'd
I'd
be
love
so
to hear
fun.
that.
I'd love that. And then we also have an email.
Yes.
So if you have any questions about things that we talk about, I mean, we can't give you specific advice because we are not your personal therapy clinicians.
Yeah.
So we have to have some professional boundaries. But if you have, general questions about things that we talked about, or if you want us to talk about something specific,
Yeah.
please let us know. You can message us on Instagram, or our email is thecotreatpodcast@gmail.com, but it's the co-treat without a hyphen.
Yeah.
So it's the co-treat, one word. The co-treat, wait, what is it?
The Co-Treat Podcast, all together.
All together, no hyphens,
No.
at gmail.com.
Yeah.
So we will talk to you guys. What is it? How are we going to sign off? I forgot.
Have a great week. See you next time. Wasn't that it?
Yeah.
Have a great day.
That sounds great.
Sure. Have a great day.
Have a great day. Bye.